All right, everybody. Today we're going to talk about health savings account. Many of you government employees are offered these HSAs at work, but you're confused. Are they good for you and your family, or are they not? I believe they are. This episode, we're going to discuss that a little deeper than what you typically hear about. We're going to have some really genuine questions coming from Officer Ty, how he might be able to utilize this, how he can pay for services. Big deal. I love HSAs. Stick around to hear it up. Welcome to the Cedar Harvest Show, Law Enforcement Edition, where we focus on financial education for a variety of things that not only affect your life, but also your spouse, your children, your charities, and your legacy. This particular episode, we're focusing on the law enforcement officers and health insurance benefits. Okay, we discuss everything from health insurance and pensions, wills and trusts, to the best way for everyday tax planning. Our intention is to bring the financial and legal professionals together with the everyday people who need their help. We have real conversations with real people who have real life questions and scenarios. And again, today we're going to discuss another version of health insurance, and we're going to specifically dive into health savings accounts, commonly known as HSAs. Yep. All right. I want to introduce our co-star here, Officer Ty, 18-year veteran in Arizona, law enforcement, getting ready to retire here in a couple of years, and has lots of questions pertaining to what am I going to do in retirement? Yep. Right. How am I going to be affected when I leave this great job that I have now and these great benefits I have now? What happens to me when I jump over to the dark side? Yep. You can become self-employed or do whatever you're going to choose to do. So these are great questions. And again, we're going to focus on this is part 3 of health insurance. And today we're going to focus on HSAs. Yep. Right. And I look forward to testing your knowledge, my friend.
No, it's gonna be bad.
Yeah. I
Yeah.
don't know. You've been digging around a little bit, so I think you're already prepped a little bit. You cheated on me. I know. I'd love to just catch you up.
But I don't really we'll see, I guess. We'll see.
All right. All right. We'll see. So, there's a lot of my clients. I personally love HSAs.
Okay.
I love HSAs. And for my clients who are any of my healthy clients, 100%, who don't qualify for subsidies, I always recommend HSAs. Always, always, always. I love HSAs.
Why?
Make a lot of sense. Because reality is, statistically speaking, you're probably needing a tax deduction. Okay. So I love the fact that you're nestling money into a health savings account, which is a true savings account.
So, just to stop you. So with that, with you saying that, does that mean that I should be putting money into it then? Because I have an HSA, but right now the only money that's getting put into it is what the city gives me.
Which is great, right? That's another beautiful thing of why you should have.
But I always hear about tax reasons.
So if you are an employee and you have a generous employer where they are willing to contribute a little bit to your HSA,
Yeah.
absolutely. Reality is you have an annual limit of what can be contributed into that HSA.
By me or by the city? Or whoever. Okay.
The collective.
Okay.
All right. So in 2025, that annual limit is $4,300.
Okay.
For you as an individual.
Okay.
And $8,550 for the family.
Okay.
Okay. So if you have a family in this HSA, then you can contribute up to $8,550. That's going to lower your taxable income for all the money that you've put in.
Okay.
Okay. So, and that increases by 1,000 per individual. Well, husband, wife, if you're over 55.
Okay.
Okay.
So it behooves me to put money into it.
Absolutely.
Okay.
That money accrues. It's going to lower your taxable income today. That money is into a true savings account. A lot of people get health savings account confused with flexible spending account, which is an FSA.
Yeah.
Very confusing. All these acronyms.
Yeah.
And so HSAs are great. They accrue. I know a lot of people, it's part of their retirement strategy to get a bunch of money nestled away in their health savings account for when the time comes down the road that they need medical attention.
Okay.
Right? Even if they're healthy as heck now, the time, hopefully, here's what I tell people. You want to need your health insurance because the only way you're not going to need your health insurance in the future means you instantly die.
Okay.
Right?
Okay.
That's what that means. If you went through life and never used your health insurance, that means you just had a car accident, something, you're dead.
Okay.
Right? You want to have, none of us want a problem, but inevitably we have some bumps along the way and you need to go in and have things dealt with.
Okay.
Right? So when you're not finding a lump somewhere or anything going on, it means you're not using your health insurance to find it. And then you found it and then you've treated it so you continue to live.
Okay.
So really there are, I never really thought about it that way, but I had a conversation with somebody who brought that up. And I was like, and that was my response. Like, you want to use it? 'Cause they're like, I don't ever want to use it. Well, there's a point where you do because that keeps you living,
Yeah.
right?
Yeah, you should be getting your what is it, 45? You need to be checking for
All sorts of things, right? It goes on and on. So again, with HSAs, let's talk about this a little bit. People are confused by them, when to get them, when to not get them. I recommend getting them all the time. HSAs, one of the positive things about HSAs is they typically have the lowest out of pocket maximum.
okay.
Okay. And we talked about in episode 2 on health insurance, we talked about out of pocket maximums and how those work. So with your HSA accounts, you typically that's where you're going to find your lowest out of pocket maximums because the whole thing about an HSA, the whole premise is the health. You are basically taking responsibility for your upfront healthcare costs.
Okay.
Most of the time, most HSA plans, they don't have doctors' copays for the upfront benefits. They don't have copays for prescriptions. They're typically designed for healthy individuals.
Okay.
And so you really don't have much benefit within the plan until you reach your out-of-pocket maximum. So you're basically telling the insurance company, "Hey, I'm all in on my own healthcare costs until I reach that 5,000 out-of-pocket maximum,
Okay.
5,800 out-of-pocket maximum." Compared to a typical copay plan, which is like a $2,500 deductible 80/20 copay. Remember that
Yep.
scenario?
Okay.
8,000 out-of-pocket maximum type deal.
Okay.
Those plans always have, I shouldn't say always, 98% of the time will have a higher out-of-pocket maximum because the insurance company is getting involved sooner.
Okay.
$2,500, anything after that, they're getting involved. You go to the doctor's office and you have a copay to go see the primary care physician, 25 bucks. The insurance company's paying a portion.
Yeah.
So because they're paying in earlier, they require you to pay in longer.
Okay.
Does that make sense?
Yep.
That's the way they look at it. They're in the game earlier, so you're in the game longer.
Okay.
Right? So that's one of the things I love about it for my healthy clients because the only way they're going to max out is if they do have a big deal, knee replacement, a big ass accident, something major,
Yeah.
right?
Okay.
And so along the way, while you're healthy, you're going to be sitting there lowering your taxable income by funding that plan. So if the city is currently funding for you 2,500 bucks, whatever that is a pay period, take a look at maxing that out, get it to that extra amount.
Okay.
Why not? It's going to accrue. You're going to use it. And one of the fun things that we're about to do right now that I thought is let's do a Q&A on what's covered through your HSA, right? Let's take a look and let's see. Most people are very confused. What is an HSA? And then beyond that, how do I use the HSA? So maybe before we get into the quick Q&A of what's covered, let's talk about how things are covered and how you pay for things. So I assume with your HSA, you said you're currently in one?
Yep.
And my guess is they probably sent you a handy dandy little HSA Visa
Okay.
card,
Yeah, like a
debit
Visa
card.
card. Yep.
Right? And then they probably also sent you a checkbook.
I don't have a checkbook.
Okay.
I have the credit card though.
That makes sense that they stopped doing the print.
Yeah.
Before they used to send you a checkbook and a debit card,
Okay.
that was attached to that HSA. So I have certain clients who fully fund their HSAs every year. They just write a check and they transfer money into that HSA so they get the tax deduction.
Okay.
I have other clients that don't, they transfer money into their HSA account once they incur a cost, a healthcare cost. Okay. So you can, and then they still ultimately pay using that debit card. Okay.
Okay.
But they'll leave the account empty until they go to the doctor and they have a $300 bill.
So what's the benefit of that? Just
No
not
benefit. They're
no.
they're still getting the $300 tax deduction.
Okay.
Reality is if you do not have an HSA account, the IRS states that you do not get to deduct medical expenses until they exceed 9.5%. I believe is the number. Hold me to that number, but I'm pretty sure until it exceeds 9.5% of your gross income. So if you have a standard copay plan and you make $100,000 a year until you have $9,500, 9.5%, okay, of medical expenses, you don't get to deduct those expenses,
Okay.
right? So if you have $8,000 worth of expenses, you're using post-tax dollars to pay that $8,000,
Okay.
right? Whereas if you had an HSA account, you could have routed a lot of that through using pre-tax dollars.
Okay.
And that's a big deal. That's a 20 to 30% savings just in
Okay.
taxes. Okay. So people overlook that. They don't really do the math. They don't think about it in a long-term budgetary sense. And if you do the math on it, they're great plans.
Okay.
All right. So again, you're gonna have this account. You're gonna have money sitting in your savings account. Comes with a debit card. You're gonna route everything through the insurance company, so there's a track record of it. And then the insurance company ultimately, we've all seen the statement. Okay, here was a service. The retail cost was $1,000. After insurance adjustment, it was actually $200. Insurance paid $50. You owe 150.
Yeah.
Right? We've all seen that statement.
Yeah.
At some point. So now you're going to take your HSA card and you're going to pay that 150. All right. Whether you transfer money in for the 150 or you already had a balance in there, it depends on you.
Yeah.
Doesn't matter. Reality is today for 2025, you can, as an individual, you can do $4,300 per year.
Okay.
8550 for the family. Okay. Or
does it start in January?
starting in January.
Okay.
And you can write that check in there, clear up to December 31st.
Okay.
Right. So you can take that tax deduction. And I wonder, I mean, talk with your tax guy. Maybe you can fund it clear up through April 15th. I don't know the answer to that. I'm not a tax guy.
Okay.
But it's possible, but I don't believe so, but I don't know. So, the next question comes down to what do you get to spend that money on? Right. A lot of my clients are confused about, okay, what's this thing? What am I setting up? HSA, what?
Yeah.
And then beyond that, like, okay, so what can I use it for? So let's just start with the easy stuff. All right. So let's just start at the top. Do you believe you can pay your copay bills with an HSA card?
Yes.
Correct.
Okay.
All right. One for one.
For what?
Looking good. All right. Check. Okay. So now let's say you've hurt your thumb. You need an x-ray. You go in and you get an x-ray and you get a bill. It goes through the insurance and you owe $100. Can you use that? Can you use your HSA account to pay for that?
Yes.
Yes. 2 for 2. Doing well. Okay. So let's move on. Let's talk about dental.
Okay.
All right. Got a broken tooth. You go into the dentist. You got your insurance. It's covering whatever it's covering. At the end of the day, you owe $225 towards that's your portion. Can you use your HSA dollars for that?
I'm gonna say no.
Okay.
No. Okay.
Yes, you can.
Damn it. Okay.
Good. That's good. It's good. That you're not. Most people don't realize they can use their HSA money for dental insurance.
Okay.
So that's a big deal, right? So again, you're using pre-tax dollars to pay that $225 bill.
Okay.
Okay. Let's talk about eyewear. All right. Go to you got $500 worth of lenses on your glasses. Can you pay for that with your HSA account?
Yes.
That's correct. All right. Doing good. 3 for 4.
Okay.
All right. So that's the beautiful thing here, right? It's not limited. Okay. So now I'm going to throw you a curveball.
Okay.
All right. Can you go to Walgreens and use it for Band-Aids?
No.
You're wrong again.
Really?
Yes, sir.
So anything medical related?
Pretty much. Not anything. We have to be careful how we say the words anything. But there's a long list of things that you can use, even in an over-counter scenario,
Okay.
you can pay for using your HSA account, using pre-tax dollars.
Okay.
Most people don't know that. And then beyond that, what can be kind of cool, a lot of things turn into a prescription scenario.
Okay.
Right? Like you can't right now just go in there and buy Gatorade with it.
Yeah.
But if the doctor prescribed you Gatorade, guess what? You can use your HSA account.
Yeah.
So what's real important here is you're going to have to keep track of all your documentation because either way, you're going to pay for it through your HSA account. And so technically, you're supposed to keep track of that documentation because you need to prove that you use those dollars for, in this case, Gatorade that was prescribed by a doctor.
Okay.
You can't go into Walgreens and buy a 12-pack of beer on the receipt with Gatorade using your HSA account.
Yeah.
See what I'm saying?
Yep.
So even though they're both sold at Walgreens, you can't do that.
Okay.
So it's upon you to keep records and receipts to make sure that you were using your HSA account for credible pieces.
Okay.
Does that make sense?
Yep.
So one of the things that we talked about before this is, which I thought was very intriguing. You asked me, can I pay for my sauna?
And cold plunge.
And cold plunge. And I'm like, no way. I answered that. Nope. And you showed me the website where they're stating you can use your HSA dollars. And it kind of dawned on me after that, after kind of thought about it, I'm like, that really surprised me. But I guarantee you what it comes down to is, was it prescribed by your doctor? Right? Is this cold plunge going to affect this ailment you have in your life?
Okay.
Is it part of the prescription to a remedy? Right?
Okay.
Is my guess. I could be wrong on that, but that's what I'm going to go with. The reality is when it comes to healthcare, laws are changing. Laws are state by state. There's a lot of quirkiness. So I've learned to say, well, this is what I think, but let me go find out definitively.
Yeah. Because Well, the reason I brought it up is because I was looking at one. There's multiple ones I was looking at. Not all of them have the same little tab that says HSA, FSA funds can be used for it. There's a few of them that do. So that was what brought it up when you asked the question. I was like, well, this one I was looking at says HSA, FSA is available. So
Well, I'm going to give a plug out to this website that I'm looking at right now. This is called HSAstore.com. So, according to their homepage, the complete HSA eligibility list. Here it is, the most comprehensive eligibility list available on the web from A to Z. Items and services deemed eligible for tax-free spending with your flexible spending account, health savings account, health reimbursement arrangement, and more will be here. Complete details and requirement. Important reminder, HRAs, FSAs, and other account types can vary by plan design. So they got their caveat in there,
yeah,
right? So my guess on the HSA side and FSA side, it's going to be a more limited list. Here it says right here, is there caveat? Always check with your HRA or FSA administrator, right?
yeah,
And that's what you need again. You need a good broker, so you can call me up. Hey Mario, can you find out for me? And I'm going to tell you, good luck, Officer Ty. I don't think so, but I'll ask.
yeah,
And I have the resources. Got the number in my phone to call and find out. And that was pretty cool to find out that they even said that there.
yeah. It says
So,
it on there.
so
Yep.
if you can get it prescribed, but I'm going to take a look, HSA, and I'm going to put on your cold plunge, and I'm going to see if it comes up because I don't think it will. Search results. Oops, we can't find cold plunge on the list.
Try sauna.
So far that's saying no, but I'm willing to bet because that's not my default. Right? Again, this is where I'm going to say I'm willing to bet if you're prescribed. So when I type in sauna, no, I'm not getting any.
No.
I'm not getting anything for sauna as well. But again, I'm willing to bet if it's something prescribed that it's going to override the standardized list. But I'm sure you're going to have to provide some additional documentation in the event you get audited.
I'm almost curious because like I said, I've been in the market to get. I had one, but I want to get a little bit better one.
Cold plungers on it.
Both.
Okay.
Um, and the one that I found is a bundle deal, and I think it's still on sale, but it has the little HSA tab on there. So I'm curious if I go in there and try to pay with my card to see if it's going to go through or not.
I'm really curious myself. So you're going to have to do that. Walk the path,
Yeah.
you know, and my understanding is HSAs don't really vary,
Yeah.
right? The IRS has a standardized list of what's acceptable, what's unacceptable.
Yeah.
So I'm really curious if they're going to say okay without a prescription.
I bought a red light, um, like back for lower back pain, but it's one of those red light therapy things. And I used my HSA account for it and it let me go in there and
Well, I'm sure that just because they're allowing you to buy it, I don't know if I really believe that that's necessarily makes it technically legal
yeah.
by HSA standards. If the IRS came in and
I'm going to get audited now is what you're saying.
I'm not saying you get audited. I'm just saying if you were to get audited, I wonder how that would come about. I wonder if they would ask for a receipt to prove that, right? And maybe red light therapy is something. So I'm good. So that's a good question. Red light.
Yeah. Let me see if I can find that. I remember what the
See, there are a handful of
red light.
nah, well, light therapy, Lux collection, skin treatment panel. So there are a few things in here. But I'm not see. So let's type in red light therapy and see what pops up. So I do have a handful of
Those
items.
things.
So assuming, I mean,
Yeah. The red light
there's a
mask.
there's a few different things, but it's
Mm.
not. So I really, now you've got me intrigued here, right? Like, where's the line?
Well, the reason I brought this up is because
We need to call these guys. We need them on the podcast.
we should. Yeah. It would be interesting. Well, I would like to know, like, from the sauna box people, sorry, I'm not saying that's who I was looking at, sauna box. And maybe call them and be like, because all it just has is, you has your options when you pay, credit card, you can do the PayPal, but then it has HSA. but then it has that little TrueMed. So maybe that'd be somebody to talk to, like the TrueMed people, because it sends you to the TrueMed website when you do it. And I haven't gone that far yet. I've just seen that it's on there, that shows HSA, FSA available, but then it's like through this TrueMed. So I don't know, maybe just needs to do more research on the TrueMed.
this is something that's I'd be really curious myself. So either way, it's kind of interesting that you have a possibility of getting to
Yeah.
buy that sauna
Yeah.
using pre-tax dollars,
Yeah.
right? And so now you've got me definitely intrigued. Um, I don't know. I'm sure that again, most websites you put in a credit card number, they don't care if it's an HSA or not,
Yeah.
right? It's going to be. I'm sure it's upon you to know the law and make sure you do what's going on, right? Just it's like, hey,
Yeah, but I don't think, but
isn't that true in the law enforcement world? What's that? What it's called? Like
ignorance is not a
yeah, ignorance.
defense. Yeah.
So I think my guess it's kind of like that scenario.
Yeah.
Like, oh, you just got around it. Well, they sold me the
Yeah.
alcohol,
It said
officer.
HSA on there.
Yeah, it said it. What do you want?
Yeah.
How am I supposed to know?
Yeah.
So I don't know. I'm gonna go with it's that play, and they're just kind of
Yeah.
I know that
I'm
you're
gonna
never get
do
audited.
some more research on it because I'm curious now. Because
See, maybe we shouldn't have asked
yeah,
because now you're gonna find out. Now
it's gonna ruin my. I want to know more. I guess it's basically finding more about this TrueMed is who it's through because I've seen other things with the HSA on there.
okay, true, Med. We need to know what's going on here. Can somebody reach out to us and help us
Yeah, if somebody
understand?
sees this from TrueMed, please tell us.
An HSAstore.com looks like a great resource for people that I'll start telling my clients about that have HSAs. But we need some clarification here. Somebody who
Yeah.
truly understands HSAs through and through. I know them at a surface level. I know what you can fund. I definitely love them. I highly recommend them to anybody out there. Even if you're unhealthy, I still recommend them because of the lower out of pocket maximum, right? There's a lot of people on there who are on very expensive medication. So it's a race to the out of pocket maximum. Remember that out of pocket maximum question?
Yeah.
So if your out of pocket maximum is $5,800 versus 8,000,
Yeah.
who cares? Pay the upfront costs, max out in the first 3 months, and your healthcare is 100% free after that.
Yeah.
So, I'm going to stress to everybody out there, always take an annualized look at your cost. Premium plus out of pocket maximum.
See,
Eh,
I need to do that. I need to see what with this new because like I said, I've only had it for a couple years.
It's so critical. People don't do that. They get so caught up. I want the $50 copay to go see the specialist. Well, let's talk about that. Okay. If we're going to buy a plan that's going to be $300 more a month, that's $3,600 that you're going to spend just so that you can access that specialist for $50.
Yeah.
Right? Well, if we can find you a plan that's gonna lower your out-of-pocket maximum by $30,000, what are you doing?
Yeah.
Right? And so a lot of times I talk people off that ledge just by penciling out. Take an annualized business approach, and you will see that more often than not, the HSA accounts are a better value, better bang for your buck, even if you're unhealthy. Where the HSAs aren't as attractive for time, it's for some like I was wanting an HSA for our account. We have a copay plan. My partner has different things going on in her life, so she's seen a lot of different specialists and whatnot, and just proactively staying on top of her stuff.
Yeah.
So she really sees a lot. So she really was always wanted the copays. But as I penciled things out, what we found is that she was going to save overall around $2,000 over the course of the year because she typically maxes out her plans. Unfortunately, having this surgery, that surgery, da 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 da.
Yeah.
She's going to save $2,000 in cash flow if we were to jump over to the HSA.
Okay.
Unfortunately, I caught it too late because I knew that she was uneasy with the HSA.
Yeah.
And so I didn't really bring it up. I didn't really push the episode. But I'm the one who would almost lose in that deal because if I were to have a minor ailment, right, and I go in and I need like a basic outpatient procedure, which anymore is going to cost probably $1,000,
Yeah.
right? If I had a copay plan, maybe that outpatient procedure would only cost me $200 out of pocket. Whereas now I'm on the hook for the $1,000. You don't have any coverage really outside of, and let me back up with that when I say no coverage, because that's not accurate. Your coverage, you have what's called network repricing.
Okay.
And this is really important. So if you show up at the doctor and he's like, they're asking for your insurance, like, I don't have insurance. Well, they have a cash pay price, right? There's no network versus if you show up and say, I have United Healthcare. They don't ask what your deductible is. They're going to ask what's your network. And then they're going to ask for your card, right? You go in there, they always ask you for give me your ID card. And the reason is because they want to see the United Healthcare. But on top of that, they're looking at which plan you're associated with.
Okay.
Because by them accepting United Healthcare and you having that plan has what's called a fee for service schedule associated with it. So that's basically saying that they've agreed to United Healthcare's price for that particular service.
Okay.
Okay. So when you're in your deductible phase, you're not paying the retail rate. You're going to pay the wholesale rate, which is that network reprice
Yeah.
rate.
It's usually on the card, right?
No, no,
No?
it's such a big list. They could never fit it on the card.
Okay.
So, but the reality is it's a benefit that people don't recognize. You go to Home Depot and you see the lumber cost, you go into a pro lumber yard, they pay a lower rate,
Yeah.
right? Wholesale rates.
Yeah.
It's a substantial savings.
Yeah.
But people they get upset because like, "Oh, I'm paying $500 a month for my plan. I should get this for no cost." That's not the way health insurance works,
Yeah.
especially in the United States, especially with group plans, Obamacare, because what people don't have to understand about these insurance companies, they are on the hook for unlimited amount. Right? They can't say, "Oh, once you get to $100,000, we're done. We're not spending anymore." They're on the hook.
Is that different in other countries then, the way they do, like, the socialized stuff?
It's different within plans within our country
Okay.
that aren't part of the ACA,
Okay.
which is Obamacare. So if anybody to be a qualified plan as far as a actual group plan, or an individual plan that's Obamacare, qualified, Affordable Care Act qualified, that's one of the criteria,
Yeah.
the unlimited benefit. So if you're in a coma for 2 years, right, they can't cut you off,
Yeah.
right? I personally know, my one of my best friends from college, his daughter was in ICU for, like, 6 months, saddest thing you've ever seen in your life. She was 3 years old. She should not be here to this day. She racked up $3 million in bills. They were
Oh,
out of pocket $10,000. To my knowledge, she's still alive to this day. She survived. Had they not had insurance, she'd be
no.
gone.
No way.
Well, yeah, shouldn't have a chance. I mean, there were so many tubes coming out of this poor little thing,
Yeah.
but they were using, every modern medicine trick that they could to keep her alive and get her over, whatever ailment she had. I don't recall, but it was so sad. So people have to realize that's why we pay so much for insurance,
Yeah.
because we have that kind of opportunity. And believe me, if your daughter was in that situation, you would
Well,
fight completely to, you know,
yeah, I mean, it's not to that extent, but when my daughter was born, she was in the hospital for 11 days because they thought she had some issues going on, but we only paid, total for everything was only like $400, and it was
wow.
yeah, and it was she was in the hospital for 11 days, 11 or 12 days, I don't remember exactly, but they had her on machines the whole time because they thought she had some kinda breathing issue going on.
So do you think the hospital covered that cost, or do you think the insurance company did? The insurance company
I
is
said the
the
insurance
answer,
company,
yeah.
yeah, and
The hospital billed the insurance company,
yeah.
and this is why we pay so much for insurance, and we all get very pissed off and get upset about the high cost of healthcare costs, but I assure you, once your loved one is in need of
Well,
care.
yeah, and, and that was the thing too, so it was I mean, whatever, it was Cigna. I had Cigna at the time, and they like I said, it was like $400 and they covered the whole thing, and I used to tell people like, "Yeah, you might." At the time, people were shit talking Cigna a lot because you had to go to their doctors, and Cigna had that big network of just Cigna hospitals that you had to go to, and if it was out of network, but
Yeah, problems.
I have nothing bad to say about them because that probably should have been a lot more expensive based on
Well, that brings up a whole nother topic and conversation that we should talk about on a future podcast, which is the HMO versus PPO conversation.
yeah.
People are
That's
very
something else I wasn't when I signed up, when I got my health insurance when I started, I had the Cigna HMO, and that's what I had for most of my career up until, a couple of years ago when I started this HSA plan. But that was the reason I left the Cigna was because, where I work got rid of Cigna as an option for the health insurance. Like, I still have it for dental insurance, but they got rid of it as far as an health insurance side of it, so
interesting. Yeah, the HMO world has really lost a lot of popularity. People, we really want convenience,
yeah,
right? And just in a nutshell, most traditional HMOs means that you have to go see, your primary care physician to be referred to a specialist,
yeah,
right? And within the health insurance world, there are a lot of networks, and a big part of what you pay a lot more money for is the more expansive network of providers,
Yeah.
the more narrow focused, the less providers, the less money you're going to pay.
Yeah.
Right. So when you're in a place like Maricopa County, there even that narrow network is massive.
Yeah.
Right.
Well, I'd say a lot of people had the Blue Cross program because it was, because it was wider. Your
Network. Yeah.
and the Cigna one was smaller, but I mean, the time I had it, never had issues with it. I used it quite a bit. Like I'd go get my yearly checkups and everything, and I never had issues with it. So
It's typically people that have challenges going on in their life, and the specialist that they need, that they've heard can fix them, is over there, which is outside the network.
yeah,
Right. And that's when people get really frustrated and they don't understand and they want to see the
I
person.
think. I mean,
That's the challenge.
I think the only issue that ever came up with it is I tore my bicep in 2015, and most of it was covered. But then, so this might be something we could talk about in another podcast because it still kind of irks me to this day. But everything was set good. Get into the surgery. They put me out, and then they had to switch anesthesiologists.
Oh,
And
it was out of
it just so happens that he was out of network, and so then I get this big bill, you know, after the fact, and I was like, well, nobody ever said anything to me that you guys were gonna switch this. So, like, how is that my fault that you guys,
Yeah, that's a big challenge, and that happens going into the ER situation, especially.
Yeah,
And it is a fight, and you have to fight with the providers. I can tell you that your health insurance company will likely reimburse you,
yeah.
right?
Well,
They
eventually it just went away. Like, I fought it enough where it just was like, "Okay, we're gonna deal with it."
Well, and that's what will happen. You know, they eventually they will, because typically when you have an out of network provider, part of the reason they don't take, in this case, whatever, we'll just say Cigna. Again, remember that fee for service schedule, the
Yeah,
network repricing.
yeah,
So a provider has to agree to that fee for service schedule. So a lot of times they'll say, nope, I'm not going to take that company because I want more than what they're offering me.
yeah,
Right. And so that's why they're out of network. So many times it'll get down to a point where they will say, screw it. I'll take what they're offering me and I'll just
just deal with
write the
it.
rest off.
Yeah,
Right. It's better than nothing.
yeah,
Another time, there's many other times where you could just go in there and just, the reality is the medical world is extremely negotiable. Right? You go in there and be like, "Hey, look, these guys are saying they'll pay $150 of the $300 bill. I can give you $150 and they'll reimburse me, and let's call it a day."
yeah,
Right? But a lot of time, but you have your billing departments that are that frontline defense for the provider.
yeah, mhm,
So you got to kind of get
yep,
through that, and a lot of times that can be a challenge, right? And so it's tough, and I don't know what the right answer is because it's really frustrating. And when the time comes, I'm fighting that battle. I'm sure I'll be so upset, like I hear so many of my clients that are so upset.
yeah,
Um, but I honestly, being on the insurance side, I'm an advocate for the consumer, not the insurance companies. I understand the insurance companies. I understand the rules of the insurance companies,
yeah,
but I'm an advocate for you,
yeah,
right? And so I'm just trying to help marry up your needs with what these guys can provide.
yeah,
It's pretty black and white, right? My favorite line to tell people is buy insurance for what it is, not what you want it to be, right? This is an emotional decision.
yeah,
If you're making it emotional, you're going to lose and you're going to spend a lot more money,
yeah,
right? Buy it for what it is, and what it isn't, and so you need to really understand what it isn't. You need to make sure you have a good broker that can help you find out the answers of what it isn't.
yeah,
And that's what brokers should be here for. That's what agents are here. So find yourself a good agent. That's the moral of the story. It sounds like we've teed up some other conversations, HMO versus PPO.
yeah.
What happens when I have an out of network physician come in, the anesthesiologist come in?
What happens?
Really? That's yeah. All right. I'm glad you're on my side, man. I'm gonna call you.
I was throwing stuff. No, I wasn't.
So,
That was pretty funny.
all right. So I think this is enough for today. And I mean, come on, we can only talk about health insurance for so long. That's
Yeah,
we're boring each other, more or less the audience.
yeah.
So so great being a health insurance agent. Let me tell you,
I
I
bet
my
I
life
bet
good.
you love it,
I do. I actually do.
especially when is it October when it really starts?
Yeah, yeah, but I do love it. I really do. I like understanding the complexities and variables of what's going on with you and your family, with marrying that up with the complexities of
Yeah,
it's fun. So I do like that side. And I like the fact that I'm not rolling around fighting people out in the street and getting shot at. So that part's kind of cool for me. Right.
yeah.
But then,
It's probably a good thing.
all right, man. Another one down.
Yep.
All right.